Hello everyone. We thought that it might be helpful in providing some death notification training. Since we will be terminating more patients on the scene now, or we should be, it's helpful to know how to deliver the news. So first we want to do some planning. We're going to prepare to explain the events even before the death of the individual. So you might have to explain how you found the patient and what you did. You might have to explain the procedures to the family or the loved one. And we want to dedicate one person, if we have them, an additional person on scene to explaining all of this. And I think what is most important to remember is that we don't feed false hope. So if our treatments are failing, if the patient's not improving, and possibly even if they might be improving, we want to manage the expectations and don't give the family false hope. And if the family wants to be present for the resuscitation, allow them to be. Allow them to see what's going on, to hear what's going on. In fact, it's helpful for us as well, for the family to know that we did everything that we could possibly do for that person. If they see how hard you are working to help their loved one, they are less likely to be upset. So first of all, we need to identify the patient. So if you call on the phone, ask them if they know the person. It may sound silly, but look for identification. So we want to know the person's name to confirm that the person that we're preparing to notify is the right person. It would be a shame to call the wrong person and tell them their loved one just died. And we also want to confirm that the person that we're talking to is who we need to be talking to. Assign two people, and this could generally be a supervisor to help deliver the notification, and we want support staff. So we want an officer or deputy there to be with us when we deliver the news to the family. Whoever the person is that's delivering this news, we have to be empathetic. You don't want to just walk up to them and say, "I'm sorry, they're dead." Or you don't want to just say, "There's nothing more we can do," and then walk away, right? We need to listen to them. We need to listen to them. We need to be empathetic to their needs as well, because once the resuscitation is over, then our attention should turn to the family. Gather the information beforehand to make sure that it is all accurate. Not all of the information is going to be shared with the person you're notifying them, or it might not be shared with them all of the time because it could be a criminal investigation. So some common questions that they might ask is, how do you know it's them? What happened? Where did it occur? And where are they now? So just prepare to answer those questions ahead of time. We also need to prepare for their reaction. And we have to prepare to deliver that notification. And part of preparing to deliver the notification is being aware of how they might react. You might be concerned if you're delivering it to someone who has a lot of medical conditions. They might have a panic attack. They might start having difficulty breathing. They might have chest pain, and we're going to have to care for that. You also might be a little concerned about aggressive behavior. That's why we need to deliver the news in pairs and have support staff there in case they do become aggressive. And they might ask a lot of questions, and you need to make sure you have the time to answer them. So when delivering the information, at the point that you are delivering it, first confirm the identity and ask them to sit down if they can sit down, right? If they're driving, maybe have them pull over. Now, once everyone is seated, if it was not a witnessed event, you're going to have to brief them on what happened before you reveal the news, okay? So a good example is, I'm sorry to inform you that despite our best efforts, your loved one has died away as a result of, and then tell them why. So I'm going to repeat that because this is a very good, short, concise statement that relays all the information you need to initially. Say, I'm sorry to inform you that despite our best efforts, your husband, wife, sister, father, mother has died away as a result of cardiac arrest, or their heart stopped beating, or their COPD, whatever it might be, drowning, a car accident. So if the cardiac arrest or resuscitation is ongoing and in progress, relay the events to them. Tell them everything that's happening. Be honest. Don't sugarcoat anything. Tell them their heart's not beating, they're not breathing, and explain that you are doing everything possible, that you're giving medications, that you're controlling their airway, that you're shocking their heart. Tell them that you're doing everything that they would do in the hospital, and then let them know that it's not looking good, that they might not make it, that they are dead, and they might not survive. Use their name. Don't say the body, the remains, or use the relationship. So if it's the husband, wife, father, daughter, mother, things like that. Use the relationship. Do not confuse them. You might have to repeat the word dead or died, and we want you to use that word. Say dead. Say died. Say those words. And then offer to call, and then the support person, the person that's going to be there, the law enforcement, city police, county police, they're going to be monitoring their reaction, or they should be monitoring their reaction and ensuring scene safety. And then there is a list of questions that they might ask. Where are they? Can they see them? You shouldn't have to answer questions about autopsies. That should be more in the realm of the coroner or law enforcement. If you don't know, say that you don't know and find out. And then support them by asking if there's anyone that you can contact or that they need to contact themselves. Some things that you should say that are helpful, right, and that will not hurt the situation even more so is say you're sorry, say it's harder than most people think, say that a lot of people that have gone through this react similarly. That lets them know that the way that they are reacting is normal. And say that it's normal for people to experience many different feelings at the same time. And also let them know that this may be one of the most difficult times in your lives. You don't have to say all of that. Those are things that you can say because, as you well know, it's difficult to find the words to use, to find the right words to use in situations like this. Things that you do not want to say, don't tell them about your loss, because your loss is not the same as theirs. Even if you think it is, at that point in time, they're not going to care about your loss. This is about them. Don't tell them that you know how they feel. Don't say time heals all wounds. Don't tell them they need to be stronger, that they'll get over this. Don't use any of these words because they are pitfalls and they are not helpful. Don't say you don't need to know that. Don't say you don't want to see him. Don't try to be religious. This is not the time to use religious phrases. If they ask for you to pray with them, and if that's something that you want to do, you can do. You're not beholden to that. You're not required to do that. But don't try to be religious or you use religious phrases because they might have a different religion or believe differently than you do. Children should not be present for the initial notification. And if they don't, if they speak a different language, you shouldn't use children to translate. I know that's obvious, but the death notification should be delivered by a person that the child knows and trusts. After notification, talk to each other about your experience, your reaction. This is the time for you to talk about your experience. I know that sometimes you may have to keep some things bottled in during these moments, but I would love for each of you to ask, to inquire your partner about how they are doing. You need to dedicate time to debrief with one another. Do something that reduces your stress. During these periods, you can get parasympathetic backlash. So basically, you have this massive sympathetic dump. Your heart rate has been going 150 beats a minute, and then you're just fatigued. Take some time for yourself to relax, to eat a candy bar, to get something to drink. And if you need to, there are resources for you to talk to people. We have the Employee Assistance Program, and the phone number is on jcems911.com. I hope that you found this a little helpful and that it might help you in the future when you have to deliver death notification. And if you ever have any questions, please let me know. Thank you all.